Studex, worldwide distributors of high-tech ear-piercing supplies and high-fashion earrings, presents to you its video guide to ear piercing. Using the Studex pre-sterilized ear piercing system, you'll find everything you need for quality ear piercing. The purpose of this video is to help you master the art of customer service by showing you the proper use of your ear piercing system and giving you some helpful hints along the way. Studex pre-sterilized ear piercing equipment is packaged for easy access with everything you need even before your client arrives. With your quality Studex equipment and excellent customer service, your clients will always think of you first when it comes to earrings and ear piercing supplies. Your professional manner and confidence in ear piercing is the key to customer service. Some clients will be anxious, but your calm, professional demeanor will greatly enhance their comfort level. After your client is seated, ask them to choose which earrings they would prefer. Conveniently located on one display, Studex provides a wide selection of fashion-piercing studs. A standard within the industry, it's imperative you ask your client to read over and sign the release form. Studex includes this release form in our standard piercing system. Make sure your client understands the form and signs it before you proceed. If your client is under 18, a parent or guardian must sign for them. The release also refers to valuable aftercare instructions that the customer takes with them. Also keep in mind your client's state of mind and physical condition. There are those who are quite frightened of needles, so be aware of this and make a point to reassure your client as to the safety and simplicity of this procedure. And it's never advisable to pierce the ears of intoxicated clients or frightened babies. Now prepare your client for the piercing process. Pull their hair back and secure it by using a hair clip to keep it out of your way. Always wear sterilized latex gloves while working with your client. Most gloves come ready to wear with powder inside for comfort. Remember to wear the gloves during the entire procedure, then discard and never wear one pair of gloves for more than one client. Check the area to be pierced visually. Then, by gently pressing the surrounding area between your thumb and forefinger, look and feel specifically for lumps or any other irregularities. If you find an irregularity, point it out to your client and explain why piercing at this time is not recommended. Have your client remove any earrings they're currently wearing. Thoroughly cleanse the piercing area. Your Studex pre-sterilized ear piercing system includes Medicept alcohol prep pads. Use a Medicept alcohol prep pad and completely wash the entire area. Ask your client to show you exactly where she wants her ear pierced. Using the specially provided surgical marking pen, mark the spot on each ear. This marker is non-toxic and specially formulated for use on skin. Do not use any other type of pen or marker for marking ears. Let your client see the marks in the mirror to confirm this is the correct placement. Your client may decide to move a spot, which will require you to once again use the alcohol Medicept prep pad to remove the spot and reapply it in the newly selected position. After you've reapplied the spot once again, have your client check to make sure the spots are exactly where they want them. Taking the piercing instrument in one hand, pull back the plunger handle with the other hand until a click sound is heard. The ear-piercing instrument has 3 stud adapters to allow your client to choose from a wide variety of piercing studs. One adapter is kept at the barrel end of the plunger ready for use, while the others are easily accessible in the handle storage area. Select the appropriate adapter for the selected stud and attach it to the barrel end of the plunger. When the correct adapter is in place, pull the trigger until a click sound is heard. Now you're ready to load your ear-piercing instrument. When the selected adapter is in place, pull the trigger until a click sound is heard. Setting the piercing instrument down on the sterile surface, use both hands to peel back the blister tab and open the stud package. To maintain sterilization, remember never to pierce with studs that have been touched or opened prior to this piercing. Remove the plastic mount that holds the studs and clasps. Slide the stud head into the stud holder. Then insert the clasp into the clasp retainer and return the plastic mount to the sterile surface. Pull back the plunger to cock the piercing instrument. Slide the earlobe between the clasp retainer and the stud holder. When you're certain the tip of the stud is pointing directly at the center mark, make sure the instrument is level and slowly squeeze the trigger until the barrel snaps forward, piercing the ear. Pull the instrument straight down and away from the ear. Your client's ear is now pierced and the clasp is attached. Using the Medicept ear care solution, wash the newly pierced area thoroughly. Then go over the care slip with your client so they feel confident about what they need to do for after-piercing care. Even if this is the second piercing for your client, make sure they understand it by going through it with them. It's attention to their needs that will promote repeat sales.
They look really good.
You like them?
Yeah, I like it.
All right.
Studex, all over the world. For more information, call 1-800-4-STUDEX.